Hey, this is Marty Stepniak, Senior Writer for Hospitals and Health Networks magazine, and I'm joined today by Mundy, who is President and CEO of CVPH Medical Center in Plattsburgh, New York. Stevens, thanks so much for being with me today.
Thanks, Marty. Happy to do this.
Could you just start by telling us a little about the Adirondacks Medical Home and how you came up with this?
Yeah, so the Adirondacks Medical Home was a primary care initiative that was started 7 years ago. In upstate New York, in kind of a very, very rural region. Initially, it was trying to improve the life of primary care physicians, and it's turned into this tremendous initiative that has done that with our primary care physicians. We see satisfaction going way up, incomes are up, but most importantly, we've improved the quality of care for our patient population in our region. And reduce the cost of healthcare.
You talked a little earlier today about the importance of partnerships and how critical they have been to succeeding and excelling in this changing healthcare environment. Could you talk about why partnerships are so crucial to you guys?
What you'll realize in this is that we thought partnering with our primary care physicians was going to really just be the end of this, and that was our goal. And what we've learned along this journey is that that's the very tip of the iceberg, that you have to partner with your care managers, but you have to reach outside your organization, your home health agencies, your mental health agencies. We've partnered with our local NAMI, the peer-driven mental health organization, county health departments, other behavioral health services, just anybody that we can think to partner with, we're doing it now.
And you've talked about how partnering around data is key too. Why is data so crucial to excelling in this regard and moving forward?
I think data is so important because for a number of reasons. One, it will allow you to figure out, whether it's through geo-mapping or other things, looking at your ERs for high utilizers, getting triggers in so that you know when they come back in. It allows you to treat patients. But you got to get your data right so that you, from your value-based purchasing contracts, can get paid appropriately.
And you said too that it's not the traditional types of data you think of. It's not just the general things. It's things about what they're eating or their lawn being mowed. Could you talk about how it's different types of data than you traditionally think of?
Absolutely. It's not it is the traditional data, but it's so much more than that. It's your readmission rates, and length of stay is important. But looking at your ER visits and seeing who utilizes it, we set a threshold of 10. So anybody who has more than 10 ER visits in a year, we're really drilling down on with a community-based team. But then they go and they look, what are the triggers within that patient? Is it food needs? Is it other social needs? We had one patient that we talked about in the talk today who literally his garbage service had been turned off and his grass was 2 feet tall. We got a social services agency in. They actually volunteered to do it. They identified it and got those two issues taken care of him. And now he's up to over 20 days without an ER visit.
Mm-hmm. Could you talk a little about what the results for the medical home have been in terms of savings and where those savings are coming from?
From a quality standpoint, first, we've seen tremendous results. Our quality in our ACO, we formed an ACO midway through our medical home project. Our average quality score is I think it's 86. So we're way up there from a Medicare standpoint. And then from a cost standpoint, Medicaid, our state Medicaid, did a match study of over 16,000 recipients and identified two similar populations. Again, we were higher on 46 out of 57 quality metrics, but the two populations had $16 million difference in healthcare costs, and really feel like a lot of that was due to the efforts that we've made in that region. So that's about a 25% savings for Medicaid. So they're highly interested in what we're doing.
Mm-hmm. And could you talk a little too about where you're failing and where you can get better and learn going forward?
Yeah, I think you can't underestimate the need for really, really robust data. And we listened to a speaker today, Fareed Zakara, talking about data in our organizations. And I really listened to what he said and believe that. We had designed a data product 7 or 8 years ago, and it really met the needs for a very short period of time, and then the world moved so far beyond it, and it wasn't able to do that. And so we've got another data tool that will integrate cost, quality, claims, really everything. We can get that information out to providers. So data is an area where we've failed and succeeded and failed. And then I really think that the engagement of specialists beyond the primary care physicians is critical. And actually, kudos to you guys. I referenced an article unknowingly at the time in my presentation on a GI hospitalist that you'd written about. And he had looked within his practice and reduced the cost of Crohn's patients. I think it was 15%. It was enough that it was really important, and we sent that article around to all our GI physicians and have started a really good conversation around that. And engaging specialists in primary care around this in a very collaborative fashion is something that is a challenge in front of us.
Great. Stevens, thanks so much for being with me today.
Absolutely. Nice to see you, Marty. Thanks so much.
For HNHN, this has been Marty Stepniak. Thanks for watching.